All right. So, what else can a coach do? All right. So, let's say that you're working with an athlete who has gone to a physical therapist, right? Coach has diagnosed them, let's say, with patellofemoral pain syndrome, so knee pain, anterior knee pain that hurts with like deep squats and that type of thing. What do you do as a coach for that individual? Well, for one, it's important to modify all training that causes to the point where you cause minimal to no pain. Alrighty? So, if you have an athlete that has a bunch of knee pain and we don't change any of their training whatsoever, let's say they continue squatting, they continue running, then what happens over the course of time is that their pain generally doesn't get any better, and a lot of times it gets worse, just like we said before. So we need to be able to help that athlete out, so we're applying just the right amount of stress for them to progress over the course of time. And that means that we just don't want to irritate the knees, but we still want to stress the knees a little bit. All right? And here's what I use. I use something called a patient-specific functional scale. All right? That's a physical therapy tool that we can use for two things. For one, it can be used to see where people are in terms of the rehab, so how bad their knee pain is and how that affects their activities they want to get back to. And then they can recheck that over the course of time through rehabilitation to see if they're actually making progress, right? I also use this as a tool to figure out whether or not we have to modify movements. And in the patient-specific functional scale, you rate all the movements that you feel limited in. So if you have shoulder pain, usually push jerks are a problem. So you'd write that down as an exercise you want to get better at, right? And you rank that movement on a scale of 0 to 10. So 0 to 10 is bad. It means that because of your injury, you can't do this movement whatsoever at all, okay? So 0 to 10 means I just can't do this at all because of this terrible pain in my shoulder every time I try to do a push jerk, right? Now, a 10 out of 10 means great. It means you could do push jerks all day long, every day, and never have any pain whatsoever, okay? So let's take our theoretical example person of someone who has shoulder pain, okay? And let's list the movements that give them trouble. So the movements that give them trouble are going to be the push jerk, bench press, pull-ups a little bit, muscle-ups a little bit, and maybe a little bit of snatch. Everything else is okay, right? So for movements that are going to be below an 8 out of 10, they need to be modified, okay? So push jerk was rated as a 6 out of 10. We need to modify that movement. So what do we give them? Well, let's try a strict barbell press because that's slightly easier. Now, if that strict barbell press is an 8 or greater out of 10, and we're doing it with minimal pain in the gym, awesome. We just accomplished a perfect modification, all right? Let's talk about bench press. Let's say bench press is about a 7 out of 10. Okay, that's going to be below that 8 out of 10, so I want to modify. So what do? Okay, let's try maybe using a close grip. We're switching to dumbbells, and we'll press there. How's that feel? Oh, that feels great. No problems there. Perfect. Great. Let's take a look at pull-ups. Well, pull-ups, they're mostly good, not 100%, but, pretty close to that. About a 9 out of 10. Okay, good. We don't need to modify the pull-ups, but just be careful of the total volume and the intensity of pull-ups. We don't want to go so crazy on pull-ups that the shoulder gets worse, but in general, it's a pretty good movement. Okay? Same thing goes with muscle-ups and snatch. These movements are 8 plus out of 10. However, they're not 100%. They're not a 10 out of 10. So what that means is that you just have to be a little careful with the load and the volume of these movements. Okay? So if you don't do this form of modification, you don't necessarily need to do the patient-specific functional scale, but if you don't do any sort of modifications with painful patients, that means they might just keep being painful indefinitely, all right? So you can see just how powerful the modification is as a coach, and if you don't modify, you may never get your athletes out of pain, and you might be the reason why they continue being painful, all right? So you can see just how important it is to have modifications on hands for athletes to have pain. Okay, so I just kind of answered this, right? Why modify? So for one, what we're doing is helping our athletes progress back to regular training, right? So if you have an athlete and they're just resting 100%, they might not get better at all. So as a coach, when you're giving someone a little bit of stress, you're actually helping them out. And for some injuries, if you do nothing, it just doesn't get better, right? The other thing that you're doing is you're not exacerbating their current injury. So we have research about this. If you have, let's say, a patellar tendinopathy or a patellofemoral pain syndrome, which we just talked about, if you continue your activities, right, and try to rehab on top of that by adding additional strength, manual techniques, whatever it is, our results are generally not very good. We need to modify, right? Otherwise, we continue irritating the issue and it just sticks around. Okay. The other reason why it's super important to modify as a coach, and this is a little bit different slant, is that these athletes are coming to you because they want something, right? Whether that's to lose weight, get stronger, right? Be healthy, play with their grandkids, whatever it is. So these athletes have goals, and we want to make sure they can continue working towards their goals over the course of time and not be completely sidelined by an injury. So if you're really smart about your exercise modifications, you can keep that person progressing towards their goals. That's two birds with one stone. You're doing a phenomenal job as a coach. So it's just going to add so much more value to the people that you're working with if you know how to modify. And it's absolutely essential for progress with 3 exclamation points.